Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Xen Sams. Welcome back to the Better, Brighter You segment brought to you by Cyspera. Today, we're thrilled to have Dr. Corey Hartman. He's a board-certified dermatologist and founder of Skin Wellness Dermatology in Birmingham, Alabama. With over 15 years of experience in the world of skincare, Dr. Hartman is a trusted expert specializing in minimally invasive treatments, hair restoration, and laser dermatology. His approach is rooted in science, and he uses the latest techniques to provide patients with solutions that work for their unique needs. He's going to join me right now to chat about innovative skincare solutions and discuss aging, hyperpigmentation, and the rise of non-invasive treatments. Dr. Hartman, thank you so much for joining us today.
Hello, I'm happy to be here. Thank you.
Absolutely. This is a fascinating topic to me because it never gets old. Hence, skincare for me is with skin being the biggest organ in the body and the growing demand for minimally invasive treatments. How do you see the field truly evolving? I mean, what do you think is driving? There's this shift towards more accessible, non-invasive skincare options, especially as we move toward a more skin conscious culture, if you will.
Yeah, I mean, we even see the tweens are getting in on the action, but it's become a lot more pedestrian. It's become a lot more openly discussed, and innovation is really taken over to allow you to do things that can prevent your skin from having to undergo very drastic procedures later in life. So a lot of those surgery cases can be prevented, kicked down the road for a long time if you take care of your skin from the beginning.
It's all about proactive, not reactive, right? And
Absolutely.
it's interesting to see the shift towards non-invasive treatments. And you touched on it, the tweens. I mean, I think Sephora stock has gone up, a gazillion percent this year, just based off of TikTok. And so in recent studies, the American Society for Dermatological Surgery found that non-surgical procedures have increased by over 50% in the last decade. And this truly reflects the demand for immediate results with less downtime. And it's really clear that technology and accessibility are playing a huge role in transforming the industry. So you've worked extensively with injectables and laser dermatology. How do these treatments compare in terms of effectiveness and longevity, especially when it comes to achieving number one results that are both natural looking and, more importantly, long lasting?
Right. So a lot of the products that we have on the market, were developed to be sort of temporal. I mean, that's kind of how they preached it. And it was more still focused on correction instead of prevention. Because with some of the fillers that, were originally introduced, it's all about replacing volume that has been lost. But you're not really addressing the skin quality. You're not addressing how collagen is produced. And in the long run, those are the things that contribute to truly healthy skin. And if your skin isn't healthy, no treatment is going to it's always going to be more optimized if your skin is in its optimal condition. So treating the skin has been really important. And fortunately, there have been a lot of advancements that allow us to take advantage of the natural processes in the skin to encourage those to remain healthy and functioning so that we can preserve as much as possible. And that's really been the biggest shift.
I totally agree, number one. And I think I back what you're saying. It's important to focus on those long-term solutions that don't just give us an instant fix, but also maintain that healthy glow over time. So when it comes to hyperpigmentation, which is a common concern, especially for those with darker skin tones, we've seen this increased awareness about the importance of effective treatments. So how do you typically approach hyperpigmentation in your practice, and how do you balance innovative treatments like Cyspera with traditional options?
The best way to treat it is really to have a good, solid skincare regimen. One that's going to encourage your skin to minimize inflammation, not suffer a lot of breakouts, not have a lot of changes and swings with respect to hydration levels, because all of that can drive the hyperpigmentation. So that's the first thing that you want to do. And then you really want to get into some of these topical products just to kind of work in the background to keep everything under control. we often take a multifactorial approach with hyperpigmentation because it can be so difficult to treat and so individualized per patient. So most patients, although a topical regimen is necessary, it's not always sufficient. And we add chemical peels. We have a variety of different lasers that can attack pigment where it can be in different parts of the skin. And we even can do a little microneedling, which has shown more success with hyperpigmentation and dyspigmentation than anybody even expected it to do.
Yeah, hyperpigmentation is definitely a tricky issue to tackle. The research doesn't lie. The American Academy of Dermatology has shown that skin of color tends to have a higher risk of dark spots, especially due to that post-inflammatory hyperpigmentation. So with that in mind, I mean, correct me if I'm wrong, but it's great to see products like Cyspera gaining attention. And what's remarkable about Cyspera is that it's proven to have significant effects without causing the side effects like hypopigmentation or achronosis, right? That some other treatments can really leave behind. So it's certainly making waves. As someone who specializes in hair restoration, I'm going to pivot a bit. It's clear that a lot of people struggle with hair thinning and hair loss. So what are some of the newer approaches to treating these issues, and how has that tech really changed the landscape of hair restoration?
Sure. So, speaking of microneedling, another example where microneedling can be beneficial to really stimulate the blood vessels to start flowing well and get those fibroblasts moving to create as much active, healthy collagen as possible. Because remember, your hair is a skin appendage. So, if the skin itself is not healthy and functioning at its highest level, the hair may suffer as a result. So that's kind of the first thing that you want to consider. And then start thinking about some of these procedures that we have that can really make an impact. The biggest procedure in our practice for, hair loss is PRFM. You may have also heard it called PRP, platelet-rich fibrin matrix or platelet-rich plasma, which is kind of like an older technology to a certain degree, but it takes the growth factors and the platelets that are inherent in our blood, spin it down to get rid of the part that is not beneficial for, regenerating tissue, and use that to inject into the scalp or to use transdermally through microneedling, the little channels that you create when you microneedle, to get that into the skin where it can then boost the quality of the skin. It helps the skin to not be as thin appearing. It gives it good turgor so that it has good, what I call bounce back. And it just keeps your skin with a nice shiny surface that reflects a life of good health.
Yeah, I love this is a great technology. I love that you highlighted it. It's making a huge impact. And treatments like PRP and those injections have become more accessible, which is great because, 10 years ago, this was not a thing. So I love that, when you look at the clinicals and the research, that it's shown those positive results in increasing that hair density and stimulating growth, which is fantastic for patients who are seeking those less invasive options, right?
Absolutely.
Now let's discuss the role of clinical trials in the development of skincare products. So Cyspera, for example, has been shown to be effective for hyperpigmentation, has completed trials with a significant portion of patients from skin of color backgrounds.
Yeah.
How important is it for clinical research to specifically include diverse populations, and why do you think this is critical in product development?
Well, we, as dermatologists, we are medical doctors first. Everybody goes to medical school before they become a dermatologist. So our foundation is really in empiric data, like good, solid research, that findings that you come to by doing, fair and balanced trials. So research is always going to be ultimately important. And, there's been a history of not being as inclusive when it comes to doing some of that clinical research for many different reasons. But what it leads to is products that haven't truly been tested on every part of the population. And so when you're recommending products, it is important to understand how that product is going to interact with that patient as much as you possibly can. So that is one of the roles of clinical trials just in general. But, when we're recommending products, we want to see some scientific evidence that it's going to do what it says that it's going to do. Certain companies really do that work and invest the money and time into those trials, which are rigorous and designed to get exact the validity behind the product. And then that's a good starting point, but then it actually has to work. And that's the other part of what I've really loved about using Cispera. It was the first major disruptor to using hydroquinone. You mentioned some of the side effects that hydroquinone can give, and it has eliminated all those and really provides a more natural looking result.
I love that you mentioned that. And it's so important to make sure that clinical trials reflect the diversity of real world patients, right? Because as we know, hyperpigmentation can represent differently across various skin tones. And the fact that Cyspera has over 80% of participants from diverse backgrounds has a strong commitment, and that shows that strong commitment to addressing the needs of all patients. So it really speaks to a more inclusive and personalized approach in skincare, which I think is truly proprietary.
Absolutely.
Now, finally, as a dermatologist, when you're recommending treatments for aging skin, how do you weigh the scientific evidence behind the product against the safety and efficacy of the treatments you use in your practice? Like for hyperpigmentation, do you feel that more brands should invest in those research in that long-term research and the effects for specific skin types? What's your take on this?
Yeah, I mean, the more science, the better. Typically, clinical trials first establish that it works, and then they show long term that it's going to be safe over time. So, those studies, again, that just highlights the importance of doing good clinical work because that's sort of like the baseline for most dermatologists where we're even going to consider it if there are safety studies behind it. Because the ramifications of poor outcomes in patients with darker skin tend to be a lot higher stakes. There's more inflammation. If a product causes any sort of irritation, if it's not managed properly, it can actually make the hyperpigmentation that they were seeking to treat in the beginning even worse, which is never, ever the goal. So the safety has to be there. The product obviously has to work. And we want to see that both in the work that they put in on the clinical side, but then also in real world. It has to match up.
Yeah, I agree. Brands that commit to that rigorous research, especially on diverse skin tones, are making a big difference in achieving results that are both effective and safe, and it really paves the way. Now, I do, 2025, we're at the midpoint. There's been a lot of conferences, a lot of congresses have come our way in the aesthetic and derm world. What have you seen that you're really excited about coming into the end of 2025? What should we be expect to seeing as of the summer,
Sure.
trend-wise?
So we are moving into an age of regenerative medicine where these trends of preservation and prevention are really starting to shape the products and technologies that we're all getting excited about. So it's either biostimulatory injectables, which have been like given a second breath of life, it seems, after some people have decided that HA filler may not be for them. And we are seeing that we want the treatments to really mirror the patient. So a lot of autologous treatments, a lot of stem cell talk of honing your own cells to be able to generate, products and injectables that will benefit you in particular. Regenerative products as far as devices, the way that some of these devices are delivering energy to darker skin types. So we're kind of moving in that direction, and I'm really excited to see it.
Wow, you're just a book filled with knowledge. I'm sure you are a KOL at some of these congresses, and it's great to see that you do your research and that, of course, peer-to-peer research and study groups are extremely important to you. Continuing ed, I think, is the most important thing for in your field specifically. It's very quickly evolving, but the clinicals and the research and the data, I think, speak for themselves. So thank you so much for coming on, for sharing your incredible expertise with us. It's really refreshing to know that there's so many of you at the forefront of this very complex world of dermatology, that are really keeping things in check and providing us with the most incredible information.
Thank you so much for having me and helping me to spread the word.
That was the Better, Brighter You segment brought to you by Cyspera. That was the incredible Dr. Hartman, definitely check out Skin Wellness Dermatology at skinwellnessdermatology.com, or you can check them out on the gram at skin.wellness.derm, and you can follow Dr. Hartman at dr.corey Hartman. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by Cispera. If skin discoloration is making it hard to find your Zen, Cispera can help. Stubborn pigmentation, dark spots, and uneven skin tone concerns go beyond the surface, affecting both confidence and self-expression. In a sea of skincare choices, Cispera stands apart. Backed by science and trusted by dermatologists worldwide, Cispera is powered by the advanced cysteamine isobonic amide complex, delivering clinically proven results and effectively targeting mild to persistent discoloration while restoring the skin's natural glow. Unlike harsh treatments, Cispera is formulated for all skin types, including sensitive areas, ensuring visible improvements without irritation. Whether pigmentation is a new concern or a long-standing struggle, Cispera works in harmony with the skin to bring balance, clarity, and renewed confidence. Cispera is science-driven skincare for confidence that shines. Find your skin zen and restore your glow with Cispera today by heading to Cispera.com.